Okay, we are starting now. Hopefully, inshallah, all the students will be taking care. Before starting my lecture, I should share my good news today. When I was coming out, I received a phone call from my son that he had a newborn baby. Baby born. He's in Canada. He's a doctor. He's a radiologist. Alhamdulillah. So he's doing his fellowship in Canada. So this baby will be a Canadian one. So you feel proud, if one of the students are your, you are just like my daughter and my sons, right? So if I see you people getting some achievement, it boosts us more as a teacher. Teacher is just like your father, right? Okay, so we are going to start. This is my last lecture of this inflammation process, and the last lecture of you second year students, inshallah, will be together in third year when you will be inshallah with us. So so this is a part 2 of this tissue repair. We know about tissue repair, that all the inflammatory process which goes on, ultimately you had to go for a tissue processing or tissue repair. So, and we also know that there in repair process we have two things. One is regeneration and a repair process, which ends up with the fibrosis. And we also know what is regeneration and what is repair, right? And usually both of the things goes together, as we will see it now. So in regeneration, we know that occur all the time in the labile cells. We know there are 3 types of cells: labile cells, stable cells, which is also called quiescent cell, and permanent cells. So labile cells are continuously in the cycle. And as I said, it depends on the demand and supply. If the demand is low, the cycle will move slow. And if the demand is more, then the same cycle will start moving a little faster. And we have discussed in the previous lecture that before going to the division of the cell, it has to cross through 2 checkpoints to look at it that the cell is perfectly in a good position, right? So all the DNA inside the cell is perfectly all right. If suppose something is going wrong, then these checkpoint does not allow the cell to enter into the second phase, right? So you know that. For example, S1, it is pre-synthetic to synthetic. There is one checkpoint when the new cell is going towards the division. Then when it goes through this one and it has divided, then again it has been checked that the division of the DNAs are also been perfect. If something has gone wrong, then the cell has ability for some minutes to correct that DNA. And then if it is completely corrected, then it enters into the mitotic phase, right? If it is not corrected, what will happen? It will go in apoptosis and cell will die. Unfortunately, sometime it happens that these checkpoints, if you have your security guards not looking at carefully, and sometimes some other person can enter, right? So some cells can go through these checkpoints, and then the process of neoplasia starts, right? So this is what, good morning.
So sorry for the...
So you have entered everything there.
Everyone's entered the session.
Okay. Now this is labile cell. Number 2 is the stable cell. So it, as you know, there are only few of the organs which we have in the stable one. These cells actually mostly present in G0 phase, and when they are stimulated, then they come into G1 and enter into the cycle, right? So they are kidneys. So when the one kidney is had a problem, then the other kidney undergo hypertrophy and hyperplasia. And if you remove half of the liver, the other portion of the liver gets enlarged, hyperplastic, hypoplasia, and you can attend the same function. And God has given this opportunity to liver to do the things quickly. So only occur if residual tissue is intact. This is important. So if you see this picture, it will show you that if you see this picture, it will show you that if you remove this portion of the liver out, so if in the other picture, the lower one, you see that this portion will never develop because why?
Because there is no normal system.
There is no stem cell there. So the remaining portion which has stem cell will start proliferating and develop on the other side, not this side. So this proves that you had to have stem cell for dividing the organ. Without stem cell, there will be no division. Okay. Scarring, if the injury is severe, regeneration cannot happen. Definitely, for regeneration, you need to have specialized cells. And if the specialized cells are not there, then scarring takes place. Scarring or fibrosis. So fibrosis replaces the injured tissue, which we usually see in cardiac muscle because they are the permanent cells, and we cannot regenerate the cardiac muscles. So four component is in this process. Newly formed blood formation, or this is called angiogenesis. Number one, fibroblastic proliferation, synthesis of collagen, which forms the scar, and remodeling of the scar. So what happens? The collagen comes like anything, coming in there and going on depositing. Then the stage of remodeling starts, right? So as I was giving an example, when the mason is plastering the wall, it starts throwing the cement, and that is uneven. Then that the same mason used to level that thing, and it's very clear, clean, smooth wall, right? This is what it's called remodeling. Okay, angiogenesis. Now everything, when it has to be regenerated or in a repair process, blood is important. So newly formed blood vessel is had to be there. So there are two processes. Number one, if there is no blood vessel there, usually you see it in tumor, right? Tumor grows fast. Hmm? Initially there is no blood vessel, and you need to have blood to nourish that area. So the endothelial precursor cell, they move from the bone marrow through the blood vessel, and they process the blood vessel, enter to the area where that blood is needed, right? The blood vessels are needed, and then they start proliferating and making the blood vessels, newly formed blood vessels. This is one. The other one is pre-existing vessels. When the vessels are already there, so there is another way of making more and more blood vessels. How? They have there is a tip cell which goes out, right? A sprout will go out, and a tip cell, which is endothelial cell, it goes like an amoeboid movement and pierce the substance, goes along, and then with this endothelial cell, pericytes and the basement membrane goes, and they form a meshwork of blood vessels. This is an example of it. The upper one is the area here. There was no blood vessel, so this endothelial precursor cell, they start forming from the bone marrow. From the blood vessel, they enter into the tissue here, and they start forming vessels like this. And then they make a full meshwork of blood vessels, and it joins this with the pre-existing one. So this is the endothelial precursor cell. They start making this thing when there is no blood vessels already present there, right? And in the other example, they have already blood vessel there. They put a sprout out, and then there is a tip cell, which is basically an endothelial cell, and it goes like an amoeboid motion, and then they start making vessel like this one, meshwork of blood vessels. There is another example, this one. First of all, there's a sprout, and then this is a tip cell, which is an endothelial cell. It pierces the basement membrane, goes out, and along with this one, you have these pericytes, which goes and with the basement membrane, and it goes and join the other blood vessel, and finally it looks like a newly formed good blood vessels. All this process need growth factor, as I said. Without growth factor, nothing will go on. So each signal, each single cell need a growth factor. Here it is VEGF, which is continuously been secreting and stimulating these endothelial cells, a parasite, and the basement membrane is forming. So the whole cascade of this thing will go on. There is a proliferation and migration of endothelial cell towards it, and finally the remodel and form a good form blood vessel. Clear? Okay, good. Now scarring. By 24 hour, the endothelial cells start proliferating, as I mentioned. Fibroblasts start migrating at that area, right? In 3 to 5 days, what will happen? The granulation tissue is present. What is granulation tissue? What is granulation tissue? The question arises. Anybody from the class? Granulation tissue.
And the myofibroblasts,
And
fibroblasts,
uh,
biliary,
yes, it's very simple. Granulation tissue is a newly formed
blood vessels, and plasma.
proliferation of newly formed blood vessels, and fibroblastic proliferation is a granulation tissue, right? So in granulation tissue, you will see blood vessels and fibroblast. And fibroblast starts secreting the matrix, which is usually collagen, right? So this is granulation tissue. A week later, a dense fibrous scar will be formed, and the scar is remodeled over time. So for remodeling of the scar usually take little longer time or months. Now, summary, making a granulation tissue, very important, number one, and turn it on into a chunk of collagen, and then finally this collagen will be remodeled because the fibroblast is continuously throwing collagen, and finally the collagen will be made in a perfect way. I'm sorry. I'm in a class. I'll talk to you later. Okay. Then we have granulation tissue formation, a term derived from its pink, soft granular appearance. That's why it's called granulation tissue. Now, please don't misguide with the granulomatous inflammation, because both of the things look like, you know, the same, but it's not. So granulation tissue is newly formed blood vessel and fibroblastic proliferation. Granulomatous inflammation is a chronic inflammation, specialized type of chronic inflammation. There is when there is specialized or activated macrophages get together and form epithelioid cells. Then they coalesce to form giant cell and surrounded by lymphocyte and fibroblast. This is granulomatous inflammation. This is granulation tissue. Yes. Now, presence of newly formed blood vessels, which is angiogenesis, and the proliferation of fibroblasts. Now you know it very well that this is a granulation tissue. Fibroblast and vascular endothelial cell proliferate in the first 24 to 72 hours in a repair process. This is important for making the whole thing together. Okay. Then what happens? The vessels are very weak, very leaky. Means because it's newly formed, so the endothelial are not tightly bound together, so they are leaky, and the basically the plasma protein goes out from the vessel very easily, because now you have to nourish that area, you have to give more blood supply and oxygen to that area. Okay. Granulation tissue that is formed depend on the size of the tissue deficit creating the wound. For example, if it is a very smaller one, like a surgical incision, if you just approximate that wound by sutures, then there will be no gap, right? So the granulation tissue will be very less. But if it's a big wound, like a burn, the skin has been lost, so you need to have more and more granulation tissue there. Okay. By 5 to 7 days, granulation tissue fills the whole wound area. So first of all, in 5 to 7 days, new vascularization is maximum in a secondary union. So this is a granulation tissue looks like initially, in which, in a 5 to 7 day, these are all newly formed blood vessels. These are all fibroblast, and mostly it is collagen type 3. Very nice. Who said that? Good. Huh? Mashallah. Type 3. And then the same collagen will convert into collagen type 1, which is more stronger and looks like this. And if you see in this one, the blood vessels is becoming low and low. So mostly it has been occupied by this fibroblast, right? And a time will come that you will hardly see a few blood vessels, and majority will be type 1 collagen, and which is more stronger than type 3 one. So granulation tissue start with collagen 3 fibers, and then it will convert into collagen 1 to strengthen the wound. So if we talk about skin wound, it is been healed by two processes. One is a primary union, or which is called healing by first intention, and the other one is called healing by second intention or secondary union. What's the difference between two? We will be looking at it. The primary union, as I said, will be a clean surgical wound or a cut which is very small. Usually you get this cut while female are working in kitchen, or you may damage your hand and torn your skin. And if you approximate that thing by applying a suture or something else to approximate, that will be acting as a primary union. Okay. So occur in a small wound that close easily. Epithelial regeneration predominates over the fibrosis. Healing is fast. Why? Because the wound is already approximated with a minimal scarring or infection. An example is a paper cut or clean surgical wound. Why I am saying clean? Because if you use a knife which is full of bacteria, it's not clean, and when you do it or you cut it, it will cause a lot of problems. That's why you go for sterilization first before touching the wound. You had to have a cleaned surgical wound. What happened here in first 24 hours, there'll be a clot formation first, then neutrophil will come there, and epithelial become regeneration from the sides. Why clot? This clot will close the wound first, and it's a blessing from God Almighty that while closing that wound, it does not allow the surrounding bacteria to enter, right? It will close the wound first, and then neutrophil, as you know, it's a acute inflammatory process. The first line of defense is neutrophil. So neutrophil will come out at that area. Whatever 1 or 2 bacteria will be taken out by that neutrophils. And then the epithelium from both of the side of the skin, from the basal layer, start regenerating, right? It is first 24 hours. In 3 to 7 days, macrophages will come there. The function of the neutrophil is gone because they did it. They have cleaned whatever bacteria has entered. Now macrophages is there to clean up the things, right? The mess which has been created by neutrophil will be cleaned by macrophages. Granulation tissue is formed. Or what is granulation tissue? It is newly formed blood vessel and fibroblastic proliferation. So both of the things are going on. And then finally, collagen starts. So collagen is being secreted by fibroblast. So fibroblast has a capacity to secrete collagen. So collagen will be started and the bridge will be formed across, right? So if the cut area is there, a bridge will be formed. What happened in a week later? Granulation tissue is gone now. Now the collagen 3 will become collagen 1. Collagen is remodeled, right? And then epidermis is fully mature now. The cells which are coming from both sides slowly and slowly, gradually comes there, combine together, and then it goes up and line up like this, and the whole skin area will be formed. But the important thing here is there will be no skin appendages. What is the skin appendages? Anybody? What do you mean by skin appendages?
Maybe that the scar tissue is not formed from the epithelium, from the skin tissue,
Mm-hmm.
it's from other tissue.
No, 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 no. What? So suppose if I ask, name skin appendages. Hair follicle. Very nice. Number two, glands. Sebaceous gland, apocrine gland, whatever. So these are all appendages. So the cut area will not develop skin appendages, right? Only the repair will be of epithelium one. Okay. Now this is a very good picture and example. This is a clean surgical wound, right? It has been sutured, so the skin is approximated there, right? When you have approximated one, now come here. First of all, a scab will be formed by this clot. Forming of scab means it has closed the upper surface from the atmosphere, and it is a blessing. Why? It does not allow the bacteria to enter down. Clear? Now in down, first few 24-hour, the first cells which comes here is neutrophils, and the clot will be coming down like this, and the neutrophil is there to clean the whole thing. Now this epithelium from both sides is start proliferating within 24 hours, although it's not crossed it yet, but it has started its movement. Now in 3 to 7 days, if you see here, now the basal layer has almost crossed to the other side, right? The scab is almost been lost, so there is no blood now in a deeper tissue. A newly formed blood vessels are there. The newly formed blood vessels are formed. The neutrophil are being replaced by macrophages, and you see fibroblastic proliferation around. And the collagen is being formed, and a bridge is made, right? After a week time, you see newly formed blood vessel is also gone. Only a few blood vessels which are normally there. Normally, the macrophages are also been removed, and now this collagen is formed. Initially, in first week, it is collagen type 1, and as the time goes on, it converts into type 1, which is more tight and strong. Clear? This is primary union or union by first intention. Okay. Now this is a very good picture. The same thing which is showing here. In the first 6 hours, still you can see that a clot is still fresh, right? And you can see a cut area. Now it is on 24-hour, the shining is gone, means now it is been forming a good clot which is remaining there. In 2 days, the skin is started developing. In 1 week time, almost it has, the skin is formed, and probably after a month time you will not be able to identify that you had a cut at that area. So this is, you know, mm, thanks to Almighty that it has given us a very good repair process that in a month's time you will not be able to see. Now, healing by second intention. Now, healing by primary intention, you can specify a time, 1 hour, 2 hour, 2 days, 3 days, 1 week in primary union, but you cannot time it in secondary union because there is a big area which has been. So occur larger wounds that have a gap between the wounds. So there are big margin between the wounds. Fibrosis predominant over the epithelial regeneration because epithelium cannot go as close as the primary one. So healing is slower than the primary one, with more inflammation and granulation tissue because the area is more. So, and the examples are infarction or large burn. So what happened here? More inflammation, more granulation tissue, and wound contraction will be there, which is probably not seen in the primary one. Why? What is wound contraction? Because the wound is bigger after repair process, they used to decrease as much approximation together as possible, right? Now this is the example. This There is a burn wound here. Um, she's unfortunate, probably cooking something in a kitchen, and finally she burned herself. And the wound area is too big. And this pinkish granular area is a granulation tissue, which is, we now know it, it's a newly formed blood vessels and fibroblastic proliferation. So in exactly, there will be initially a neutrophil come there. First of all, the scub will be formed, a clot, over it, and then underneath there is proliferation, the newly formed blood, the neutrophil come there, and then after 3 days to 7 days, bacrophage will go there, newly formed blood vessel, fibroblastic proliferation, and simultaneously the epithelial cells start regenerating and covering the lower area, and then finally it goes up and they bridge the tissue together, and the epithelium is almost done. But the important thing is the skin appendages will not be formed. Now, this big area, how will you treat this? The skin cannot go and cover this whole area. So in this type of injury, you need to have skin grafting. So what the surgeon do, it takes a portion of your skin from your body and then they graft it here, right? So she need to have, I think, 3 or 4 grafts from different sides of her own body, because if you take some other skin, it will be rejected, you know. So you need to have a skin graft, and if you put it there, so it will take little longer time, but ultimately the whole skin will be formed on her, right? Now, this is actually a good example of it. There is ulceration here. And if you see under microscope, you see both of the inflammatory, the epithelial cell here, and there is no epithelium here. So if there is discontinuation of the epithelium, this is called ulcer. So ulcer is formed, and then beneath it, this is all granulation tissue. This is newly formed blood vessel and fibroblastic proliferation. You know that there is, initially there will be acute inflammatory cells. After 3 to 7 days, it will be replaced by monocyte, and then finally, from the both of the side, the epithelials start regenerating, and they cover the whole area nicely. So after, probably not after 7 to 10 days, as you see in the primary union, but it takes little longer time to regenerate the whole epithelium, and this whole ulcer is been replaced by this epithelium. Right? Any question up to here? No. Okay. So doing all this thing, macrophage has a biggest role in it, because it secretes a certain type of cytokines and growth hormone. For example, debridement, removal of the injured tissue, is also done by macrophage, by phagocytosis and collagenase elastase, number one. Antibacterial activity, it has a very strong antibacterial activity by nitric oxide and reactive oxygen species, which we have already been done in previous lecture. Chemotaxis and proliferation of the fibroblast and keratinocyte by these growth factors like PDGF, transforming growth factor beta, tumor necrosis factor, interleukin 1, and keratinocyte growth factor 7. Angiogenesis is done by VEGF, FGF2, which is also called basic fibroblastic growth factor, which is FGF2, and also platelet-derived growth factor. So angiogenesis will never happen if you don't have these growth factor. And these macrophages not only coming there for cleaning the process, but also they are doing a lot of things, right? Then finally, deposition and remodeling of an extracellular matrix by TEGF beta, platelet-derived growth factor, this tumor necrosis factor, osteopontine. Then we have interleukin 1, collagenase, and MMP, matrix metalloproteinase. This is very important in remodeling of that particular area. Contraction of the wound, as I said, if the wound is big, the skin or the body will try to approximate and allow the skin or the tissue together, right? So for doing it, occur in a large surface wound and help to close the wound by decreasing the gap between. Now the gap is more, You have to decrease it. So slowly and slowly they pull together to approximate the skin edges. Important feature in healing by secondary union, not in a primary one, because in primary you have already decreased the area. So this is needed in a secondary union, and you need to have a special type of fibroblast, which is myofibroblast. Now, myofibroblast has a pulling capacity, and it has an actin, smooth muscle actin, which actually uh, stretch together to close the thing, and they produce large amount of extracellular matrix like type 1 collagen, and these myofibroblasts are they are the activated fibroblast, and this activation is taken place by platelet derived growth factor, transforming growth factor beta, and fibroblast growth factor 2 released by macrophages. So these macrophages are secreting these factors, which allow this fibroblast to convert into myofibroblast. Now, these myofibroblast has muscle alpha actin and viamentin, which actually has a capacity to pull the things together. So contraction takes place now. Connective tissue remodeling, as I said before, the collagen are dispersed haphazardly, as the mason used to make a wall, a plaster. So it throws the cement on it, on the wall. Have you seen it while the mason is working? So they throw the cement, which is absolutely haphazard, and then they have a special instrument by which they clean and make the wall smooth, right? Exactly like that. We need to have a very smooth area here. So for that, you have to have a replacement of granulation tissue with scar by changing in the extracellular matrix, balance between the extracellular matrix synthesis and degradation. So need to have degraded extracellular. This the collagen type 3 changes into collagen type 1, which is more stronger one. First of all, you had to make the wound strong. Once the wound has made itself strong, then you have to remodel it, right? So for remodeling, you need to relax or degrade this strong collagen, right? By doing this, what you do, degradation of the collagen and other extracellular protein is achieved by matrix metalloproteinase, and this is majority of it is secreted by macrophages. Very nice. So this MMP are produced by fibroblast, macrophage, neutrophil, and synovial cells, and some other epithelial cells. Now, what they do, their secretion is induced by growth factor PDGF and PGF, FGF, and interleukin, the cytokines like interleukin 1 and tumor necrosis factor, and it is inhibited by transforming growth factor beta. So when this metalloproteinase, which goes out, it relax or degrade this collagen, and then slowly and gradually the whole thing, which is very irregular, becomes so smooth, and then it does not look an abnormal thing, right? This is called remodeling of the structure. Finally, skin wound healing in the strength of the if you remove the suture, means in the first week the skin wound is only 10% have the strength. That's why we ask the patient to don't pull the thing, move slowly. But nowadays, uh, when when we were students and we were working in a ward, as you people inshallah will go in third year, after third year, uh, after operation, they usually keep the patient straight in a bed, don't get up. Even they had to pass their urine and feces on the bed, right? But nowadays, after operation, within 6 to 12 hours, they ask the patient to get up. And after 12 hours, they ask to stand up and start walking. So they say that as soon as you start your exercise and function, the wound will help heal very quickly, right? So within 2 or 3 days, they discharge the patient. In our times, the patient used to sleep like this for 8 days until they have sutures. They will remove the suture after 8 days, and then they ask this patient to please move slowly. So this has been changed a lot, right? So there is a rapidly increase over the 4 week time. So in 4 weeks, the strength will be around 40 to 50%. Then on third month, it is 70 to 80%. 3 months, 70. Still, it is not 100%. So it takes longer time to become strengthened. So why the good wound go bad? Why? There are some things which are really important to look into it. Systemic factors, number one, nutrition. If the patient has a good nutrition, good proteins, right? Good vitamin C, it will help the patient's wound. Circulatory status, if it has a good blood supply at that area. Infection, if it does not have infections. Diabetes, if diabetic patient usually take longer time. If somebody has no diabetes, it will recover soon. Steroid, don't have to give steroid to the patients. Steroid are basically anti-inflammatory. Yes. So if you give anti-inflammatory, it will stop or delay the repair process. Okay. Now the type of tissue injured, like labile cells, quickly. Permanent cell, it will take longer time, right? So this, and they have, there is aberrant cell growth of the extracellular production, and it forms keloid sometimes, not all, right? They have these patients have a genetic problem, and they whenever there is a cut, keloid is formed. Okay, so factors that influence wound healing. Number one, anatomically, tissue involved, for example, skin, repair easily. And if it is bone, it will take a little longer time, right, to heal that process. Regenerative capacity. Skin has a very good regeneration. It's a labile cell. Bone, it's a stable cell. So it will take a little longer time. Blood supply, if you have a good blood supply at that area, will go very good. And nerve supply also, it will take time. Nutrition, if you have a good, if you have a protein deficiency, a vitamin deficiency, or zinc and copper deficiency, definitely it will cause more delayed in that one. Then movement, for example, if you have a bone fracture, so what we do is we apply a cast. We apply a cast to immobilize the bone, because if you don't immobilize and you just start moving that, that movement will cause delayed in wound repair. Foreign body, you have to remove foreign body. If the foreign body is in, the wound will never get better, right? What will it do if the foreign body is there? Which type of inflammation will be there? Foreign body inflammation. A granuloma will be formed, right? That is called foreign body. Which giant cell will be formed? Foreign body giant cell. Very good. Infection. If it is cleaned surgical wound, no infection, the wound will do it quickly. Hormones, if you give steroids, that is anti-inflammatory, that will cause problem. Clotting disorder, if somebody has clotting disorder, the first thing comes there is clot. So if the clot is not forming, it will delay the healing process. Neutropenia, because are the cells which comes the first line of defense. If somebody has neutropenia, means less amount of neutrophils. So a less neutrophil will go there. It will take little longer time. Other diseases such as diabetes, you people please kindly take care. In Saudi Arabia, diabetes is day by day increasing. Day by day. If you have one of your parent, means mother and father, either father or mother, you have 50% chance of developing diabetes in your 40s, 50s. If your both parents, mother and father, are diabetic, you have 80% chance of developing diabetes. How can you remove or stop that diabetes yourself? It can be stopped. From this age now, you had to take care. If your both parents or one of your parent is diabetic, be careful. Eat less, do more exercise. Nowadays, what we do, if we have to take something from here, we go sit in a car. Don't do it. Go by walking, do exercise, and inshallah, you will never develop diabetes, right? away from the carbohydrate. Now there are some pathological things. Hypertrophic scar. Suppose in this boy had an injury, and the skin was approximated or not. Probably it looks as it has not approximated through sutures. They are treating like anything, so the scar tissue has developed more. So here there is excessive production of scar tissue that localized to the wound, and usually it is type 1 scar, right? Type 1 collagen, because it's very strong one. The other one is keloid. Keloid is excessive production of the scar tissue that is out of the proportion. In hypertrophic scar, it has been in proportion, although it has been raised. Here it is out of proportion, and usually it is collagen type 3. So if you just touch these scars, this keloid, it will be soft as compared to the hypertrophic one. So it's basically it's a genetic one. Those familial things, they are predisposed to form this keloid. And the classical effect are earlobes for wearing the earrings, especially the females, when they make a hole here, and then this keloid process starts and a full blown keloid is formed here. So the face are upper extremities. This is proud fresh. This is exuberant granulation tissue. For example, if there is a damage, the first thing in 3 to 7 days is granulation tissue formation, which is newly formed blood vessel and fibroblastic proliferation. In these type of patient, this granulation tissue exaggerate, exuberant. So instead of putting itself below the epithelial surface, it goes out of the epithelial surface. So to treat this thing, you had to remove all this exuberant granulation tissue and make the skin approximate again, apply the suture on it, and then this will be controlled. So if you see under this, you can see a newly formed blood vessel and fibroblastic proliferation, and it is so exuberant that it is appearing on the surface. Okay, so this was all about the final summary. Again, there's it's a tissue damage to the cell, acute inflammation, the first process. The cell can regrow, regeneration, and restoration of a normal tissue. Nothing happens. Within 8 days, you feel like nothing, right? Everything has been regenerated. Inflammation, cell cannot regrow. So there is a problem. So they'll be healing with repair, means extra fibrosis will be there, and scar formation and loss of specialized function will be there. Suppose if the damage agent is persist, it will cause chronic inflammation. So acute inflammation, if it is persistent, then it will convert into chronic inflammation. Now what will happen? The damage agent, suppose if you overcome this damage agent, yes, then it will go to the healing process, and again there will be fibrosis. And if the damage agent is not overcome, what will happen? It will be doing consistent, persistent chronic inflammation. And this process usually you see in rheumatoid arthritis, in which the inflammation or the causative agent is not been overcome, and the patient will be having inflammation continuously. So if a student came to me yesterday asking about chronic inflammation, I just say ask him one question: what are the 3 important things in chronic inflammation? Number 1, inflammation. Number 2, tissue injury. And number 3, repair. So if I ask about chronic inflammation, if you just say chronic inflammation and a delayed type of inflammation in which there is lymphocyte and macrophages, this is only one part. What about the other 2? So in chronic inflammation, all the 3 processes goes together. If you take just one, your answer will be only 30%. In your final exam, if I ask what is chronic inflammation, if you see it's a delayed type of inflammation having predominantly lymphocyte and macrophages, and that's all, then you will get how much marks? 30. But if you say no, it also have a tissue injury, and finally a repair process will also go on, you will get all 100% marks. So please kindly take this thing in account. When we ask some questions like that, think carefully that are you answering those questions properly or not. Any question regarding all this thing? I have completed this, and now my inflammation and repair process is over. Alhamdulillah, we have almost completed the whole thing. Although these two topics will not come in your midterm exam, it will be there in your final exam. Go, not now, but after your midterm exam, go this thing thoroughly. And if you feel any problem in understanding anything, you can come to my office, right? Yes. Any question from the class? Any question from online? I don't know. You can raise your hand if you have any question, or you can unmute yourself.
There's one student with a question.
Yes.
So he's asked, what's the difference between exuberant granulation and keloid?
Exuberant granulation tissue basically is the granulation tissue which is exuberant, means excessive one. In keloid, it's the proliferation of the collagen, which collagen type 3. Granulation tissue, it's not basically the collagen which has been proliferating, it's the granulation tissue itself, right? Is it okay now? Yes. 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 Means last lecture or this lecture? Oh, chronic inflammation. Okay.
There was last slide. We said chronic inflammation is inflammation and repair addition. Then it was outcome of chronic inflammation. There was one of the things that is resolution, it's regeneration. One of the things in the slide was regeneration. One of the outcome of the chronic inflammation. We said it's only repair.
When still I will say that if the chronic inflammation, just like acute inflammation, if the chronic inflammation, you can handle that thing very easily. Within usually it takes more than 48 hours to 72 hours, right? Even 4 days. For example, if it's a week time, and you have overcome the chronic inflammation, it's not tuberculosis, right? Or whatever all the classification of chronic granulomatous, if it's not that, right? Only chronic inflammation, and you have taken control of that infection within 7 days, what will happen? It will be repaired like acute inflammation. So there'll be only regeneration. The repair means the collagen will not be that much fun. So if you go to the last slide, if you have that with us, show me that slide, please bring it here. And all of them, there is a question of the chronic inflammation. Yes, here. So if you see this one, that the repair, this you are talking about the last line, right? This line. So if there is resolution, regeneration means there is a minimum damage to this the area. So there will be a process of regeneration.
Like acute.
Yes, but repair process will be going on. But the damage will not be that much to cause a functional deform, right? So because they have a very good re-epithelialization, so it will go like that.
Thank you so much.
Anything else? Yes?
No more.
No more question. Thank you very much. So inshallah, even after passing your midterm and preparing yourself for your final exam, if you anytime feel, I'm also talking to the online student, you have a problem, come to my office. Inshallah, I'll try to overcome your question. Remember, before coming to my office, please kindly, because now you have a good opportunity to look into your Zoom lectures. They are all recorded, right? First of all, for example, if you're asking any question, go through my Zoom lecture. And then if you are still problem of understanding, then come to me. Because when you'll come to my office, I will ask questions from my lecture. And if you say, oh, sir, I have not even, don't do like that, okay? So you have a biggest opportunity for especially this year that you have all your lecture recorded. Thank you very much. record this one.
Your USB?
Thank you.